Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Chagas disease, commonly known as American trypanosomiasis, is a parasitic disease that affects Central and South America and is caused by the protozoan Trypanosoma cruzi. The Triatomony insect's excrement is the means by which T. cruzi is spread. Triatomone is a reduviid bug, also known as the kissing bug, because it bites people on the face while they sleep. Sounds like a great night kiss, doesn't it? The disease is named after Carlos Chagas, the first physician to describe it. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. T. cruzi begins its life cycle as an epimastigote in the midgut of a reduviid insect. Mastigote refers to the whip-like structure known as a flagellum, which protrudes from the center of T. cruzi and allows it to move about. The epimastigote reproduces by binary fission in the midgut. The epimastigote eventually evolves into a trypanosomiasis, which loses its capacity to divide but gains the ability to penetrate human cells. In reality, trypo implies to bore or punch through. Reduviid bugs feed on human blood and love to bite people's faces, which is why they are also known as kissing bugs. However, unlike a typical kiss, the reduviid insect defecates at the bite site, and if it is infected with T. cruzi, the facies may carry trypanosomiasis. These trypanosomiasis can then infect human skin cells at the bite site or on mucous membranes, notably the conjunctiva of the eyes. This can occur if a person unintentionally transmits trypanosomiasis by rubbing the bite site on their face and then touching their eyes. Once a trypanosomiasis enters a human cell, it turns into an amastigote, which means it loses its flagellum. The amastigotes replicate intracellularly by binary fission before transforming into blood trypanosomiasis, which can travel through the blood and lymph to other tissues. The blood trypanosomiasis then infect other cells before transforming back into amastigotes and multiplying intracellularly, and so the cycle continues. Now, a person infected with a T. cruzi infected reduviid insect can be bitten by a completely new reduviid bug. In such instance, the reduviid insect may become infected with trypanosomiasis, which will then find their way into the reduviid bug's midgut and differentiate into epimastigotes, completing the life cycle. Transmission of the reduviid bug to humans can also occur through contaminated organ and blood donations, which is why blood screening is critical, and it can even transfer from mother to child during pregnancy. If you have watched till here, don't forget to subscribe to Family of Science Lovers.
Many of you haven't subscribed to my channel. Please give a sub so I can keep making great content for you.
When a person becomes infected with Chagas disease, the incubation period can last up to 2 weeks. During the incubation phase, T. cruzi trypanosomiasis enter host cells, amastigotes grow, and blood trypanosomiasis levels rise. Local inflammation occurs when immune cells travel to the site of tissue injury. Chagomas occur near the bite site, while Romagn's sign causes swelling of the eyelids. Further inflammation can cause meningoencephalitis, which is inflammation of the membranes that surround the brain and brain tissue, as well as hepatosplenomegaly, which is enlargement of the liver and spleen. Trypanosomiasis prefer to target certain tissues and cells, including smooth muscle, cardiac muscle, and skeletal muscle, as well as neurons. When those cells are injured, it can cause difficulties such as a pericardial effusion, in which fluid accumulates around the heart and affects its function, or abnormalities with the heart's electrical impulses, which can lead to heart block. Symptoms of generalized tissue damage include fevers and tiredness. The acute phase ends when T. cruzi trypanosomiasis are eliminated from the blood, and antibodies to T. cruzi steadily diminish over time, suggesting that the infection has been eradicated. However, in some people, this does not happen, and they progress to the chronic phase of the illness. In the chronic phase, mastigotes remain in infected cells, and T. cruzi antibodies are high despite the fact that trypanosomiasis are rarely seen in the blood. The chronic phase might be asymptomatic, but some people experience worsening symptoms due to nerve and muscle degeneration. The most noticeable sign is cardiomyopathy, in which the heart becomes very big, resulting in arrhythmias such as ventricular fibrillation and cardiac failure. There may also be nerve damage and gastrointestinal tract symptoms, such as esophageal and colon enlargement, known as megaesophagus and megacolon. The most conclusive diagnosis of the acute phase is the microscopic identification of blood trypanosomiasis in a blood smear or buffy coat preparation. T. cruzi DNA may also be detected using a polymerase chain reaction at extremely low levels in the blood. However, there is no gold standard for identifying the chronic phase of the illness. Some useful methods include serology, which detects antibodies, and molecular assays that search for the presence of T. cruzi antibodies or antigens. There's also xenodiagnosis, which is when a reduviid bug's midgut is tested for T. cruzi. Finally, imaging, such as a chest X-ray to assess the size of the heart or a barium swallow study to detect colon bloat, can be beneficial. Finally, at advanced phases, an ECG can be used to detect arrhythmias. The treatment varies on the stage of the disease. The most successful strategy to treat the acute phase is to start anti-parasitic medicine early on, such as benznidazole or nifurtimox, and continue it for 2 to 4 months. The chronic phase focuses on controlling cardiomyopathy symptoms, such as pacemakers or anticoagulant drugs, as well as treating cases of reactivation with anti-parasitic medication. In the latter stages, a heart transplant may be indicated. Okay, a short recap. Chagas disease is caused by an infectious parasite called Trypanosoma cruzi, which is often transferred by the feces of a reduviid insect following a bite. Symptoms in the acute phase include inflammation and fever, whereas in the chronic phase there is gastrointestinal problems and cardiomyopathy.